गोवन वार्ता लाईव्हचं यूट्यूब चॅनल सबस्क्राईब करा आणि बेल आयकॉन दाबून लेटेस्ट व्हिडिओचं नोटिफिकेशन मिळवा.
कोरोनाची तिसरी लाट संपली असली तरी चौथ्या लाटेची शक्यता नाकारता येत नाही. खबरदारीचा उपाय म्हणून जुलैपर्यंत मास्क वापरणं फायद्याचं ठरेल. कोरोनाविषयी काळजी घेण्याची गरज आहे असं मत तज्ञ समितीच्या बैठकीत व्यक्त करण्यात आलं असल्याची माहिती जीएमसीचे डीन डॉक्टर शिवानंद बांदेकरांनी दिली आहे. पंतप्रधान नरेंद्र मोदी हे राज्यांच्या मुख्यमंत्र्यांसमवेत 27 एप्रिल रोजी व्हिडिओ कॉन्फरन्सिंगद्वारे बैठक घेणार आहेत. या बैठकीनंतर नवीन मार्गदर्शक तत्त्वे लागू केली जाण्याची शक्यता असल्याचंही बांदेकरांनी सांगितलंय.
The meeting was attended by almost 80 in Goa. Everybody should take it as nobody should be pressing the panic button. You should only see that the vaccination program goes on well, because one of the members said that above 60 there are some people who are still not vaccinated, and the booster dose is incidence is going down, so that also should be discussed with the nodal officer of the vaccination, that we will take forward. And the second thing they said is that we should not put our guards down by not wearing mask. The mask should be advisable till the June-July month, because any wave that goes, it takes at least 4 months for that wave to reappear or to disappear. So our third wave has gone only somewhere in the mid of February. So if you calculate 4 months from there, somewhere about mid-July period, we should be keeping our mask. And this was unanimously agreed upon by all the members. Then Secretary Health took a stock of our medicine storage, medicine availability, plus our oxygen plants, and the stock of liquid oxygen plus PSA plants, and everything was presented accordingly. And we see as of now our infrastructure is very good for handling any kind of in case we get a fourth wave. So this is what was basically discussed in the meeting today.
फोर्थ वेवची प्रेडिक्शन बी कितें येवंक शकता वा येवची ना?
It is actually very difficult, because what has been predicted is by IIT Kanpur, and their predictions earlier have also come true. So we cannot also say that it may not come, and that is the time that we have monsoon in Goa. So upper respiratory tract infection and the common cold is very, very much seen in those days. So some patients may have respiratory symptoms and they may show signs of COVID and test positive. Now our Director Health Services also said that we should also keep on our testing patients, and there should be early detection of cases. So this will apply when we start getting a lot of common cold cases to the hospitals.
So genome sequencing facility updates.
Genome sequencing facility, we are getting our commissioned sequencing machine within about another maybe 2 weeks time, whereas Azilo has already installed, but when I asked DHS director, she said it will be commissioned anytime. So we have now genome sequencing machines, but to our surprise, as of today there are no clusters in Goa. There are no new variants detected. Vaccination drive, now somebody said that the government should give it for a booster dose, they should give freely in government hospitals also. So this, whatever was discussed in expert committee, the points will be conveyed to Dr. Gorkar, who is a nodal officer for vaccination in DHS. And I think he will take necessary steps.
गार्ड्स डावन करपाक ना म्हणजे एक मास्क जाले, आनी खंयचे आमी रिस्ट्रिक्शन फॉलो करपाक जाय?
There is no other restriction anybody pointed out. Only they said that mask should be worn even in crowded places and closed rooms. So I feel everybody should now take that quite seriously for his own safeguard, because if you totally give up, then it is not correct, and then suddenly cases rise and we have no time to rectify it.
मिड जून पर्यंत तरी
Yes.
मिड जून उपरांत रिव्ह्यू घेवपाक जाता.
Yes.
Okay.
Putting a video conferencing with all these states
27.
review COVID situation in the country.
With chief ministers.
With
Right?
chief ministers of the state. And I think that is the time we will also come to know what is the central government guidelines, new guidelines on the COVID status. Because if you see the country statistics from below 1,000, it has now crossed 2,500 cases per day. So somewhere it is giving you some kind of alarm that cases are increasing at national level. So
But
there will
state
be
in ना.
meeting on 27th.
आमच्या स्टेटीन असतं ते
No, our
चेंज
state-
दिसना.
No, we don't see big change in our state. But since we had two cases in a few days back, now it has gone to 6 cases. Yesterday also 6 cases, today also 6 cases. But there are no mortalities, 0 deaths, 0 admission. I mean, hospital right now, Goa Medical College doesn't have any case of COVID admitted.
PM कॉन्फरन्स आहा पळय न्हू ती ओन्ली विथ सीएम आसतली काय तुम्ही बी आसतले तेंका थंय?
No, it will be with expert team, means team which is involved with COVID management, that is nodal officers of the state.
तुम्ही असतले?
I will be there.
Okay.
DHS will be there.